Hey there, my name is John Clarke. I'm the owner of CalmAgainCounseling.com. We provide evidence-based therapy to help people find calm again. And I want to tell you a quick story. Years and years ago, when I first got my training to become a psychotherapist, I was trained in something called psychodynamics. It basically means that early relationships in our lives are basically templates for future relationships in our lives. And the way to kind of get to feeling better is to better understand these dynamics and to kind of change how these dynamics are playing out in our relationships today. Well, this is a really wonderful way of doing therapy and a wonderful way for understanding yourself better, and it can be effective. However, when I started working with more and more clients, I found that my clients were learning a lot about themselves, but they weren't necessarily feeling better quickly, and they weren't really staying better. So I went on to find and start learning about something called CBT, or cognitive behavioral therapy. CBT has been around for a very long time, and today it's basically kind of the gold standard for treating things like anxiety and depression. So what is CBT? In a nutshell, CBT is basically the way that our thoughts impact our feelings and behaviors. It's the idea that kind of if I'm feeling anxious, then I must be having anxious thoughts. In other words, I can't be feeling anxious without having anxious thoughts as well. Now, CBT also says that those anxious thoughts are often not totally based in reality. So sometimes they're an exaggeration of reality. Sometimes we're thinking about fears that are very unlikely to happen, or even if it did happen, it wouldn't be so bad. There's also a lot of different what are called cognitive distortions. So those are just different kind of labels for how our thinking gets us tripped up. Okay, so one example would be mind reading. So a lot of times when people are dealing with something like social anxiety, they think, well, I'm nervous and I know that people can tell I'm nervous. This is mind reading, right? You assume that you know what that person is thinking. I assume that I know they're seeing me, they can tell I'm nervous, they're judging me, right? They're laughing at me in their head. Just probably not true. And even if it was true, you can deal with it, right? You can tolerate that discomfort, even if someone was thinking that about you. This is just an example of one of the many cognitive distortions. So there's different ways of kind of using CBT to help your life. So sometimes, for instance, if I'm treating OCD using CBT, so obsessive compulsive disorder, using CBT, I might use a lot of the behavioral techniques from CBT. For instance, I want to be building the client's tolerance for distress using behavioral modifications. So, for instance, if my client has a fear of bridges, then what I want to do is just slowly and systematically kind of expose them to that fear of bridges. So we might start by looking at pictures of bridges, or taking a walk to a bridge and looking at it, or going out toward just the first part of the bridge and then coming back. In reality, when we work with fears, we're not treating the fear of bridges itself. We're actually just treating the what we call distress tolerance. We're treating the distress itself, and we're getting people to basically better tolerate the distress they feel in the face of a fear. All right. So by continuing to modify those behaviors and use basically a lot of exposure, we can get people through pretty much any fear imaginable. Okay, so this is just a little glimpse into CBT. Again, it's considered evidence-based because there's so much research to support its efficacy. It has proven to be more effective in many situations than other types of therapy like psychodynamics, or just kind of plain talk therapy, where the therapist is just kind of listening and validating what their client is exploring. So it's a wonderful way to get relief fast. I highly recommend CBT for anyone that's dealing with anything in life, really, whether it's anxiety, depression, trauma, body image issues, self-esteem, things like that. CBT is just a wonderful tool that you can learn with the help of a good CBT therapist. If we can help you with that, if you're interested in CBT, all you have to do is head to CalmAgainCounseling.com to get started with one of our therapists. You can choose either in-person therapy or online therapy, whatever's most convenient for you, at calmagaincounseling.com. Again, this is John Clarke, the owner of calmagaincounseling.com. Hope this was helpful, and look forward to seeing you in the next video. Bye.